So we're here speaking with Dr. Aravinda Nanjundappa. Did I butcher that too bad?
No.
That's pretty good. Okay. And what's your title, doctor?
So I'm one of the interventional cardiologists at the Cleveland Clinic main campus. I also work as director of peripheral interventions.
You know, we just saw a presentation here at this Deepavali event on South Asian heart disease problems, diabetes, other issues, and it was surprising because I think a lot of us think of the Indian diet as so healthy. And can you tell us a little about that?
So India, especially South India, the diet used to be healthy and it is supposed to be healthy, but over a period of long time, especially over centuries, the diet is modified. What we mean by that is a lot of diet is based on milk and milk products. For example, what we call paneer, these are condensed milk. And to make any of them, we use a lot of clarified butter called ghee. And this is like a lot of ounces of butter. There's a lot of carbohydrates, rice and bread. All of this in moderation is okay, but in excess causes problems. So what we have seen in Southeast Asia, especially in India and southern part of India, is the availability of food has gone up exponentially in the last 50 years. Due to more availability of food, people are consuming more food, and also a lot of foods that are processed. This has led to obesity. The Indian obesity is very atypical. They look skinny in the hands and legs, but most of their weight is packed around the abdomen, what we call tires. But that's brown fat that gets deposited into the tissue. This same brown fat gets released into the bloodstream, can increase the cholesterol levels. The good cholesterol is low, and that leads to heart disease. There's increased incidence of high blood pressure, increased incidence of diabetes, mostly from the food we eat, less of activity, more stress, and this leads to heart attack. And also, this happens in very young age compared to the Caucasian population or the Western population. We see heart disease between ages of 40 to 50 years, where people are not expected to have heart disease because mostly they eat vegetarian. Also, mostly Indian food is considered to be healthy, and this goes on, and we see increased risk of high blood pressure, stroke, heart attacks, patients with intracranial bleed. What we hope to do is, among the festivities of Deepavali, we do want to encourage patients to check their blood pressure regularly, keep it as low as possible, less than 120 by 80. Keep your height and weight in check, so that way we know the body mass index, that is the ratio of weight of the patient to the height, should be less than 25. Indians preferably should have a BMI less than 23 even for men and 22 for women. Also, they need to keep an eye on the waist circumference. Waist circumference less than 32 for women, 33 for men is ideal. And go to the doctors regularly, at least see a primary care physician once a year. If you have symptoms of headache, tiredness, fatigue, this could be from the blood pressure, also from elevated blood sugars. Any chest pain, any arm pain, neck pain, please see a cardiologist or go to the nearest emergency room. And my advice is to eat low carbohydrate, low calories, eat in moderation, and eat healthy, preferably vegetarian, plant-based diet, reduce the milk and milk products, exercise at least 20-30 minutes a day, and keep your environment stress-free, get adequate sleep, do walking 10 to 20 minutes, do stretching and meditation, and we hope to keep them healthy and live longer.
It's, the American diet is certainly not what you would normally recommend. So is some of the higher incidences of diabetes or cardiac disease genetic in the Indian population, or lifestyle related, or a combination? Or
Absolutely, it's a combination. Some of the things such as type 1 diabetes is something that not under our control. It's what we're born with, and sometimes genetics do play a role. But the type 2 diabetes, obesity, for most of the time is from the food we eat, from the exercise we do, and the stress. So these three carry a big factor. So we need to be thinking beyond medication, beyond interventions. When it's needed, definitely medications are very important. When you have a blockage in the heart or chest pain, you need to be treated. You may need a stent or a bypass. But the key is to figure out, how do I prevent this? How do I prevent myself from getting into the hospital? So as you mentioned, eating a healthy diet and reduce the stress and walk more, exercise more, and leading a healthy life is very vital.
Okay, so this is one of those things that no matter your ethnicity, the advice is pretty much the same.
It is actually higher than the Western population. Western population, the average life expectancy is at least 10 years higher than the Indian population. And Western population, by default, they end up seeing the doctors, and also genetically they are less predisposed compared to the Southeast population for cardiovascular disease.
Well, thanks for this information. Keep up the good work, and I think you've convinced me I've got to eat a little better and exercise a little more. Thank you, Doctor.
Thank you so much.